Gwynedd Green Group, who will be hosting this webinar and hopefully sharing what we've learned and why we set up, and how you can establish something similar where you are, because we get lots of questions about it and we think it's a model that is really helpful and works quite well at the moment. So we'll go through this. So order of this afternoon, we'll quickly go through what a green group is. I think most of you are very familiar with that, with what we've been doing, and that's why you've joined us today. And then we'll focus it on really practical advice, hopefully that will help you in terms of getting started, how you build connections, growing and learning your group, transforming and expanding your work, and some lessons that we've learned, and with some time for some Q&A as well, because there's questions we often get, so hopefully be really useful for you. Just to begin with, we always like to remind ourselves of why we're all here and so passionate about it, and why we do this. And this is something we use as well, where we're also communicating the work of green groups to others, so it'll be useful for you. So the two main facts we focus on are, first, the links between climate and health, and the fact that climate change is the greatest global health threat of the 21st century. And also the fact that we as a healthcare sector are part of the problem, as we account for approximately 4.4% of global carbon emissions. And to put that into a context, if we were a country, the healthcare sector would be the 5th largest emitter. So that's our motivation for this. We know that there's lots of policy and strategy and legislation around this, driving a reduction in emissions and sustainability, improve sustainability within healthcare and in general as well. We know that in Wales we're very fortunate to have the world leading Wellbeing of Future Generations Act, which legislates that we must, as public bodies, act in a way that will not harm future generations. Our Parliament, the Senedd, was the first parliament in the world to declare a climate emergency. We have our NHS Wales decarbonisation strategic delivery plan, which is driving this work and just been recently released. And our aims are for reduced emissions and a net zero NHS, but also to be more sustainable as a whole, and is much wider than that. We also reflect on this quite often when we explain why our green group, where we feel it's so important, and that's just a visual here of the sources of emissions within NHS Wales. And as we can all see, and I'm sure you're all familiar with this, having worked in this area, there's not one single department or division within the NHS which are responsible for emissions. It's something that we all play our part in. As historically, it's often something that is focused in estates departments, for example, but when you look at this chart here and seeing that, for example, drugs and pharmaceuticals account for 23% of our emissions, it really does drive the fact that we need clinical staff, staff on the ground, everybody involved in this. And there's so many different ways that our emissions come from, so we all need to be involved, and that's a case for a green group. So where did this all begin? Tom, who's here today, started this really when he started his foundation training. He asked the simple question of, what could he do in our hospital to improve environmental sustainability, and finding that things were quite disconnected, started this Bevan Commission's Exemplar project aimed at making the connections to improve sustainability locally. And from that, the Green Group formed. So what is it exactly? It is a grassroots organisation. It's multidisciplinary, so we have both clinical and non-clinical staff from our hospital sites, and it aims to overcome that fragmented and disconnected approach to work, which you often see in our day-to-day approach to work in the NHS. The approach we use is to connect, learn and transform, and those are three main aims I think we need to achieve in order to make this successful. So in terms of connecting, it's about engaging with staff, with community and external organisations. In terms of learning, it's sharing learning with others. It's making sure we ourselves in a group understand the links between climate and health, and how we contribute to our emissions, but also how we can mitigate our effects as well. And it's also, in terms of transforming, the aim is to transform healthcare services currently as they are to become more sustainable. So there's lots of quality improvement involved in this as well. Values we often reflect on. We found our group, and we think it's quite important for other groups who wish to take this approach to be inclusive. So it's really important to be power sharing, whether you are a senior member of staff, a consultant, or a junior member of staff just starting and joining the group. It's really important to give every voice a platform to explore different perspectives, have that diversity of thoughts. And we need to have that humility and recognise that we don't all have the answers. None of us are perfect. We're not zero emitting eco warriors. It doesn't exist. You know, we all just do our parts. Recognise that there is an urgency to act. Time is the essence when it comes to climate change. We need to act as quick as we can. You need to have courage in this line of work, because you have to be persevering, and we have to have that positive mindset that collectively there is a opportunity to implement effective solutions, and it's also being grateful and trustful and not controlling even in this line of work, and working collectively, and to have compassion as a professional value, that we do need to recognise that there's lots of elements of climate justice in this, and there is an element of alleviating suffering and encouraging self-care in this work as well. So as we mentioned, the approach to the work is to connect, learn and transform. So we are going to start today. I'm going to go through connect, and then Tom will go through learn, and Gwen will go through some of the transform elements of the work, and that's the underpinning the approach to the Green Group really. So to begin with connect, this is going to focus on things like engagement, how we organise our meetings and what we found that's helped, how you can communicate well with your group, things like branding and publicity, and the stakeholders you need to engage as well. So engagement, why do we need it to begin with is a question, and in short, there are no heroes in this line of work, and I think that's true of very many areas of work, but particularly with this. It's such a big problem, and as we've seen earlier, you've seen how broad the sources of emissions are in the NHS. It can't be a single person doing it, and it can't be a single department doing it. So you really do need to engage people and get everybody on board, and it's only through that collective action that we can actually be successful in transforming the services as we wish to do. So engagement is about getting, first of all, your interested people on board. So those who are already interested in mitigating their effect on the environment, in improving sustainability, those who already show an interest, it's making sure they know that your group exists and getting them engaged. But it's then also looking at everyone who's on board and trying to see who you've not got there and what departments have you not got represented. It's trying to get them on board. And it's also looking at the stakeholders and making sure you've got the right people involved in order to make sure you're successful as a group. So how do we do that? I guess our mainstay of how we organise and keep in touch and engage people is focused on regular meetings. There's lots of questions for this, and you yourselves in your own local setup will find what works best for you. Lots of questions we've had is, do you have a recurring meeting on the same day and time every month, for example? And that's what we've been doing recently, but you'll find that in the NHS, the single day and time is not going to suit everybody, unfortunately, given shift patterns, and it's trying to just cater for that, given that you want as wide a representation as possible from different members of staff. And then sometimes we do consider changing the days so that you don't clash with any other set meetings, and using a variety of times, such as a lunchtime meeting, a late afternoon meeting, and maybe a 5:30 straight after work meeting. But understanding that often this work is a voluntary role in addition to other work at the moment, looking to sort of make that more sustainable in the future. So I think it is worth taking note of that and being as flexible as possible with people, but it's the main way we communicate and progress things is through these regular meetings. And it's also worth thinking about how you promote these and keep them up to date, which we'll come to in a minute. But it's making sure that people are engaged and they've got enough opportunity to come to meetings virtually or in person. So next, given this, I think in terms of launching, the first thing we'd recommend doing is setting a date for your first meeting and using that as a sort of launch event for your green group, because that's what today is all about. How would you set it up and get going with it? So we'll come to an exercise at the end, but in terms of that, looking forward as if your aim is going to be to set a launch date and a first meeting, and the next thing to do is promote that and make sure people know about it so you've got a good turnout. So how will you promote things? And this is where it comes to comms and publicity, which is something I've had quite a bit of involvement in. So the best thing we would say from our experience is that you need to cast a wide net. You want, as we've said, as much representation as possible, as much interest as possible, and there is no single way that captures all, so you really need to try a few different ways of working. So word of mouth is by far the most effective, because people are far more likely to attend and to be engaged when they've had a personal invitation. but obviously you're not going to know every person in your place of work, and you won't get to everyone. So other things that are useful are posters, just the traditional stick something up on the wall, check infection prevention are happy with it, etc. But they work really well. Things like WhatsApp groups are really good. We have one set up, and that's a good way of keeping people in touch. And then when you want to look at making sure you've got representation from different departments, departmental briefings, if you can get in on their meetings, or things like grand rounds, also a really good opportunity to brief people there. Also think about things like your health board's intranet. Can you get a message on there, or in your newsletter, a bulletin, or staff briefings, and also sort of send to all site emails. These are all really useful things, and ways that you can look at in terms of getting the word out about your meeting. A stall is also something we've found really useful, and I know other places who have set up their own green groups and have followed this approach, and we find this is a really good way of catching attention visually. We tended, when we've had our first meeting, and then we've had one sort of every year since, we find it's really good to do this maybe outside the canteen if it works in your place of work. It depends what you have. If there's one main area where people are passing and you have large footfall, it's good visually to catch people's attention, to get them thinking about the environment. It's a good chance to talk and have that word of mouth impact as well as getting people's ideas, because when we first started, what we found is actually there was lots of ideas that people had that we hadn't thought about, so it's a good opportunity to capture those as well. So a stall is something we would highly recommend and have found to be effective through others as well. And following that, when you've had your first meeting, this is one of ours pre-COVID, of course, you'll hopefully have that group of people representative of a few different departments, and it's about getting together and starting from there. In terms of branding, just a note on here, we eventually came up with our own logo here in Ysbyty Gwynedd, and it's something that we've that's been adopted in other new green groups now. We often get asked if people can have the same logo, and we're more than happy if anybody wants to set up their own green group and would like to adopt this branding. We're happy here in Ysbyty Gwynedd to arrange a logo to be done for you with your own hospital name or health board name if it's something you want to adopt, just to give that uniformity, but it's by no means a compulsion. But if that saves you guys a job and it gives you that sort of uniformity and belonging to the Green Health Wales network, we're more than happy for you to adopt that. So just get in touch with us and we'll share details of that at the end. It is quite important to have something recognisable like a logo or something, because you have to think about your green group in a way as a bit of a PR program in a sense, and you want people to know it and to recognise it when they see that name and that logo and what you're all about. So in whatever way or form you choose to do, I would highly recommend having some sort of recognisable logo or icon. And then we can use things like email footers. So that's what we've got on the screen now with that little sentence, and people add that if the members of the group to their email footer. It just gets people talking about it, and again it just highlights you just want people to be able to see this as often as possible, so increase your chances of raising awareness. In terms of communication and keeping people in touch, the main things that we use that we found to be useful are, of course, your mailing lists as a point of contact, and we'd highly recommend setting up a shared inbox, and that's generally done by contacting your local IT desk and just requesting that. From that, create a contact list, and then locally anybody who attended your meetings or can't attend but wants to be kept up to date, we find that's just useful to share minutes from meetings through there and any updates and everything. Social media is also fantastic. There is a lot of sustainable healthcare infused individuals on Twitter, for example. Things like Facebook and Instagram are available as well. It's just a note on here from our experience, just we found it's best to liaise with your site comms just to let them know you're setting it up, and bear in mind you are representing your health board or place of work, so tweet responsibly. There's no real policies around this nationally. Check with your local setups. There is of course a Welsh language policy which might differ from health board to health board, and I know here in Bexley we do promote bilingualism and make sure that we're tweeting and publicising in both Welsh and English. It's something to bear in mind as well. And then another area of communication that you can use is the website. So Green Health Wales as the network, I guess, in a sense that we sort of try and sit under as an umbrella. Part of the website here is a connect page where you can search by different groups by the location and speciality, and under location we would really like for every green group in Wales to be under there, and beyond. So that if you do set up a green group, please let us know and we can make sure you're on the website, so that if anybody local to you stumbles across the site and finds that your group is there, we'd love to be able for them to be contacting you through the website and find your details there, just so that you can have as much engagement and as many members as possible. So that's something we're also happy to do for anybody who sets their group up as well. Last point on here is just in terms of stakeholders. So, you know, once you've had a couple of meetings and then you've tried to reach out as far as you can with different departments, it's just an idea to look at. This is what we've mapped out as maybe, you know, some really important stakeholders that you want to make sure you've got either links in with, or someone representative maybe at some of your meetings, or at least be able to contact someone there for the different projects that will come to throughout this webinar. So estates are a really key part. There's lots of the work goes through there. You've got your procurement teams, your catering, your laundry services, transport. We often get queries about electric vehicle charging, and we've had, you know, electric pool vehicles recently, so they're really key as well. If you have a sustainability team or environmental officers, it's worth linking in with them, because they're probably a really valuable source of information, and you want to avoid duplicating work that might be already ongoing, and they'll also be able to save time for you and signposting you to the correct people as well. Your innovation and R&D departments are really useful in terms of quality improvement, and obviously keep your hospital management teams or your corporate teams up to date as well, because they'll normally will support this work and it is on the agenda nationally at the moment. In terms of your clinical staff, make sure you've got a good representation of different professions, and that you're not just got a room full of anaesthetists, for example. You want everybody on board, and you also want to make sure you've got staff like your porters and domestic staff on board as well, because they are key to making all this work. Communications teams we mentioned already, they're really useful to have on board, as well as your postgraduate and undergraduate education teams, to make sure you've got sort of students and anybody training on board. And it's also then worth looking out to your wider engagement opportunities with patients and the community. So we've done things like, you know, tree planting and having volunteers from the community involved as well, and that really does help broaden the work and get good engagement. And external organisations we've worked with, there's some examples on the screen now, and it's just to say there's lots of opportunity to broaden your work and to link in and do some exciting projects as well, which we'll come to later in the webinar. So that's the end of the Connect section of the webinar, and how we'd like to work today is we're going to stop at 3 points, just to make sure this is as practical as possible and that you have some time to engage with people local to you. So hopefully Tom in the background has been setting up some breakout rooms, and we'll hopefully set you into groups where you're with people who are close to you locally if possible. So we want you to take about 10 minutes, I think we've got now, to connect with each other, introduce yourselves. And we want this to be as practical as possible. So we're hoping that you'll leave today with some tools that you can get going and launching your very own green group. So think about if you were to go away today and hopefully want to launch your own green group at some point in the future, what kind of data are you looking at to launch? So what that'll be, when is your first meeting? And if you can within your group, start delegating tasks and sharing out the work. So is anybody in your group passionate about social media or publicity? Can anybody take ownership of that task and setting up a social media page? Is anybody able to go away today and set up your a shared inbox, start designing a poster, anything you've taken from today that you can start delegating those tasks on? And if you've got any time left after that, think about what engagement events you might do running up to that, and who are your key stakeholders you think you want to engage.
So I'm going to talk about learning, which is the next thing to do. So once you've connected with everybody, you know, you can learn from each other, and it's a good basis to start learning a bit more about sustainability. Next slide, please. So these are some suggestions for things that you could do at your first green group meeting and stall, as you've been doing, connecting with each other already. So get to know everybody. Learning from your colleagues is important. Some groups had cakes just to bring people on board, and it's useful to make sure that people can join you as well from home. And it's important, like I say, to get to know your colleagues, because everybody will be in a different place with regards to sustainability in terms of how much they know, what they're already doing, whether they've got projects and ideas that they've already tried to initiate already, or successful projects they might have. And for other people, this would be completely new for them. So yeah, so it would be really diverse, different once you start engaging with people. And when you start, you can share a presentation, and we can provide you with a template for a presentation, and then you can adapt that and make it your own for your first meeting. Next slide, please. So what are the topics which are important for us to be learning about more broadly? So climate change and health, and the health benefits of actually taking climate action, planetary health, and the connections between our health and nature. What is healthcare's environmental footprint, and what's the hotspots as well? And then also at a more local level, what are the commitments that we have in Wales? So we've got the Wellbeing of Future Generations Act, and we've got a decarbonisation strategic delivery plan for NHS Wales. And you will also have some local context as well. So it's useful to get to know that. Likely you'll have plans, policy, and local things in place. So try and find out what's happening already. And then to learn about sustainable healthcare more broadly, and to get the skills in integrating sustainability into any ongoing quality improvements that are happening, and climate smart healthcare as well. So I'm not going to go into those in much detail today, but what I'm going to do is point you to some resources that you can go to, so then you can learn more either individually or as a group. Next slide, please. So our website, the Green Health Wales website, has got links to loads of resources. So if you go onto there, greenhealthwales.co.uk, and if you go on to learn, there's loads of resources there. And I'll just show a few examples of some of those resources now. Like Yasmin has already said, climate change is recognised as the greatest global health threat facing the world in the 21st century. And that was the Lancet that said that back in 2009. But since then, they've been tracking global health indicators related to climate change. And their most recent report came out before the COP climate change conference. So you can have a look at those, and that's a really good resource to look at. As also, there is a footprint report for the global healthcare sector that Healthcare Without Harm has done in partnership with Arup. So you can have a look at that as well. So that's, restating the fact that if the global healthcare sector were a country, it would be the 5th largest emitter on the planet. And it's important that we just have an understanding of the health argument for climate action. And a good resource for that is the recent report from the World Health Organization, which they prepared for COP26. So those are some useful resources that you can look at to get that broad global context. Next slide, please. And then for the Welsh context, like I've said earlier, there's the NHS Wales Decarbonisation Strategic Delivery Plan. That sets out how we will, as a minimum, reduce the emissions from the health service by 34% by 2030. And so it shows the deliverable things that we can do, but also where the gap is for us to get to net zero by 2030 as part of the wider public sector. Then the Wellbeing of Future Generations Act means that all public bodies in Wales have a duty to protect the wellbeing of future generations. Next slide, please. And as a Green Group, we developed some principles, and just to demonstrate that the Future Generations Commission has linked those with the wellbeing goals. So collaboration, which is about connecting, which we've already spoken about today, leadership, and empowering our patients to take a greater role in managing their own health. Then mitigation, which is about trying to reduce our environmental impact. So that can be streamlining care services, so we're not being so wasteful, and then looking at what treatments we're using, so we can prioritize those with the lower environmental impact. And as set out in the decarbonisation plan, decarbonise healthcare by 2030. Resilience, so thinking how can we prepare for the impacts of extreme weather and shifting burdens of disease, and also regeneration as well. So thinking about nature as an important source of human health, and thinking of looking at how we are measuring success more holistically with health and well-being. And then justice, because the people who've contributed least historically to climate change are affected the most. And there's a lot of health inequalities even in Wales. So it's being aware of those and trying to prevent people from getting unwell by trying to deal with the causes of illness and inequality, and then thinking how we can balance our needs for providing high quality care with being able to provide quality care for future generations as well. So where can we go to start learning a bit more about sustainability? So these are some of the links that we have on the Green Health Wales website. So these are things that you can do personally. So there are courses which you can join with the Centre for Sustainable Healthcare. So they do carbon footprinting and sustainability and quality improvement. There's also e-learning that we've got a link to on the website, so you can do some e-learning yourself as well. There's a link to a Planetary Health Academy, and CPD Match is quite a useful resource where it shows you all of the webinars that are happening in a particular topic. So you can select sustainable healthcare and you can see all of the webinars that are happening that you can join, as well as healthcare without harm, and they've got lots of resources as well. Next slide, please. So how can we learn more? So that's individually, so we can also learn together. And this is, you can learn from our colleagues, like I've said before, but, your green group acts as a forum, and you can actually use it to get ideas from people. Where are the areas for improvement, and where are the examples of success and what's worked well? So you can learn together in that way. And you can also use the wider Green Health Wales network to look at what's happening well across Wales. Then you can host educational events. So we've hosted grand rounds, journal clubs and departmental talks. And then it's important to be able to communicate the information with your colleagues as well. So you can just have conversations with them on the ward or in the corridor. It's important to have a mailing list so you can keep in touch with people. You can make your own newsletters. As Ysbyty said already, have a stall. You can host information on your intranet page. And, there's also other things you can do, put displays up, posters, stickers and badges, just to help raise awareness. Next slide, please. And what we've learned as well is that it's important to have those systems in place that help us to learn better. One thing we can do is use our trusted voice as educators to help educate the public and policymakers on the topic once we feel confident with our own knowledge. So, that's something that we can do. We can also make sure that in place in our hospital, there's suitable resourcing for sustainability to free up people's clinical time to do sustainability work. So we can have sustainability fellows, which we should be coming soon to Betsy Cadwallader, sustainability coordinator and sustainability leads. It helps as you grow to have some protected time for colleagues. And then it's important that there are still areas that we don't know, so we need to develop new knowledge and research in sustainable healthcare, and then it will help us be able to make evidence-informed decisions so sustainability can be the norm. And then working to integrate it throughout undergraduate and postgraduate curricula as well. So now I'd like to send everybody back out into breakout rooms again for another 10 minutes to discuss what you think you could do as a group to learn more. So first of all, how will you get to know each other? What do you think the baseline level of awareness is in your organisation? What's the knowledge gaps presently, and how do you think you're going to be able to overcome those? And how are you going to share information with others and help raise awareness?
Okay, thank you, Tom. So I'm just gonna, slides are frozen for a second, sorry about that. So the third and final section is going to be about transform. So this is all about actually creating that change that we're all talking about, but it's so hard to deliver. And what we did with the Green Group was we organised this section into sort of different subsets. Initially we started with 5, so energy, waste, transport, food, and then biodiversity. And then throughout sort of the year or two that we've been doing this, we added an extra group, which is clinical, is because waste would otherwise be an enormous section, and so we find that this sort of helps to separate the work out a little bit better. In terms of how transformation as a section of the working group works, one of the first things we did as a group was we had lots of initial meetings where we just brainstormed ideas, and we tried to capture those into a project bank which lists all of the possible ideas of quality improvement projects that we could do, things that people find frustrating that they'd pointed out to us that they wanted to see changed. All of that went into the project bank, and what we tried to do was allocate people to those projects to then research them further and then feed back to the group. What we've done recently as well is that we've allocated a lead for each of the transform sections, so clinical, waste, transport, energy, food, and biodiversity. And that means that somebody is there coordinating various projects that are happening under that umbrella term. One of the main first things that we did was try and identify what the low-hanging fruit are within our organisation. That is to say, the things that are easy to deliver quickly to bring about change. So we spent a lot of time trying to identify what those might be. I'll talk a bit about more about those in a second. What we've also done is sort of try to think about other 1 or 2 bigger projects that might take longer to deliver but would have a big impact on the carbon footprint of the hospital, and therefore worth sort of spending that extra time doing. And also one of the things that we've been asked to do a lot is how do we measure the effect that the group's having, and the project that we deliver are some of the ways that we've done that. And you can see that over time more projects have been completed, but we've also managed to kind of keep a good number of projects in progress as well. So about 12 projects ongoing at the moment, which keeps us more than busy. So we're just going to talk about some of the projects that we've done. One of the first projects that we did as a group was to create a cycle to work guide for the hospital. So Ysbyty Gwynedd is located very close to the Snowdonia National Park, so it attracts a lot of staff that are keen on the outdoors. So there was kind of an appetite for more active transport to be embedded in the workforce. So what we did was we sent a few easy emails to various departments just to try and find out, where we can store bikes on site, where locker facilities and changing facilities are available. We also tried to find we found a map of all the cycle routes around the Gwynedd area, including I think 7 that lead to the hospital. We compiled all that into a document, published it via our mailing list. I think it went into our newsletter, which went to as a news bulletin out to all VCU staff members, and then published it on social media. So that was a really quick, easy project. And that's allowed us to sort of build on that work in the medium to long term to sort of try and actually improve our cycling facilities, meaning that there's more showers available on site and designated places for people to store their equipment and to shower. And then in the long term, we want to then promote more active travel to the site, hopefully by doing those things. Another sort of way of doing a low-hanging fruit, so an easier project, is to sort of adopt something that's happened already. So one example that we've done in Ysbyty Gwynedd is adopt a project that initially happened through the Welsh Environmental Anaesthesia Network. This was a project on anaesthetic gases. So they identified that desflurane as an anaesthetic gas has a much higher global warming potential compared to sevoflurane. And so as a department, they used the knowledge and the work that had been shared by WEEN and made that change within our department. So what we did was remove all the desflurane devices from the anaesthetic machines and kept a couple in a sort of locked area just in case it was needed for a particular procedure. And that's led to significant savings in terms of the carbon dioxide that's emitted per month. Another example that we're doing at the moment is adopting the Nix the Nitrous project, which is looking at nitrous oxide as an anaesthetic gas that's used as well. and that's based on work that's been done in Scotland and in Cardiff already. To give you an example of a sort of a more something that we maybe thought was easy going into the project, but maybe had took a little bit longer than we were expecting. So we had a plan to plant trees on site. Sent an initial application back in September of 2019, got them approved very quickly through NHS Forests, and had a donation of 100 trees accepted. Unfortunately, we weren't given planning permission to actually put those trees on the site in time for the planting season in 2020, and then the pandemic happened, which meant that any progress with those plans was kind of delayed because everyone was focusing on the COVID response instead. So unfortunately, it took another year for us to get those actual plans approved, but very recently in October we've managed to actually plant those in the end. So it's a project that maybe we went into maybe a bit naively and thinking that it would be very easy. We realised that we had to talk to lots of people in order to actually get that done. But on the more positive note, seeing those trees be planted on site and walking to work and seeing the work that we put into it, and I know it was something that caused me a lot of frustration at the time. It is very positive to see sort of the end impact of that. Another example of a project that's sort of still in the pipeline with us at the moment is based around reusable PPE, and this is one of the projects that we've decided as a group is something that we really want to see change, because the impact it would have would be massive. So we initially signed up to a reusable face mask trial in late 2020. And had a very productive initial meeting with our infection prevention team to do a pilot study within the hospital. They received all of the information about various masks that were available, and after some deliberation they did approve them for use in non-clinical areas initially. They started a trial within our estates department to see whether they could safely be used and whether the sort of cleaning processes would be practical. So we felt really optimistic at this point about this project. Unfortunately, then in April of 2021, we had a hospital outbreak of COVID, and there was a sudden change in policy, and this came from the highest level, and it meant that reusable face masks were banned from use, and every patient, staff and visitor to the hospital be required to wear the reusable face mask. Now, as a Green Group, we were really upset about this, so we sent a response letter, but unfortunately we didn't receive a reply from them, and despite ongoing engagement with infection prevention and with our corporate teams, we haven't made progress on this issue. So what we did instead, we sort of changed tact away from masks, because I think COVID and masks is quite a controversial maybe topic. So we focused our efforts on reusable aprons recently, and we've identified a alternative to the currently used aprons that can be washed up to 75 times. Got a picture there of Dr. Carson Eichmann, who's one of our anaesthetists, who has sent lots and lots of emails to try and progress this, but eventually he's managed to get a pilot trial within our endoscopy department for these aprons, and it received overwhelmingly positive feedback. There's still lots to do in order to get this to completion, including navigating procurement policy, completing waiver forms that allow us to get out of existing contracts for disposable items, obtaining funding, etc. So it's not a straightforward, easy project, but we do hope that when this does happen, that this is something that we can introduce then quickly in other sites across Wales, and we'd hope to use it as a stepping stone to try and bring in reusable face masks as well. So hopefully those have given you some examples of the projects that you could consider as a Green Group. What I want you to do within this breakout room is to try and think about what the low-hanging fruit for sustainability might be within your organisation. I'd like to sort of think about 2 to 3 main ones that you might focus on initially. And then I'd also like you to pick maybe a bit more of an ambitious project that might have a bigger impact, and try and think, you know, who are the people that you'd need to engage? So which departments would you need to discuss this with in order to get it approved? What are the main challenges likely to be, and start thinking about how you might overcome them. So we just wanted to spend about 5 minutes on speaking about the challenges that we've had, because I think we've been very good at promoting what good work we've done, and I think we're often maybe reluctant to discuss those challenges. So we just wanted to spend a bit of time highlighting those, and we've touched upon some of them already. What we have found is that, you know, the NHS is a massive organisation, and the complex structure of, you know, the different departments and how they interact with each other makes it quite hard to navigate sometimes, and it's also difficult to necessarily know what steps you need to go through until you've done them. So, you know, who should you talk to first when you want to change, for example, reusable PPE? You know, you might think that infection prevention would be able to approve it, but then they also need you to speak to procurement, and then you also need to get managerial or corporate approval. So there's lots of different factors, and it's really quite inaccessible at times. One other major issue for us has been lack of time. We all do this voluntarily on top of our usual roles, so, you know, it's difficult to ask a staff that's already stretched and overworked to commit that extra time, which is why we've also lobbied within the Green Group to try and get some funded positions for people who can work on this full time, and you know, deliver some of the outcomes that we desperately need to reach by 2030. There is also a lack of urgency about these problems sometimes, and it feels like it does sometimes take a very long time to make change within the NHS. I think I've already said this, but, you know, you might feel that you see the problems, but you might feel very powerless to change them. This is a really commonly used diagram showing you, you know, about success and how it's an iceberg, and in what you see, the outcomes that you see and what people see. They think it's easy, but you know, getting this group started and off the ground is taken a lot of hard work and dedication from a lot of clinical staff, you know, at a difficult time as well. So don't want to leave you with the sort of sense that everything will happen very quickly. It is really, on the other hand, really rewarding when you do get those projects through, and you do find that difference has happened, and it's because of the work that we as a group have been doing. So how do we counteract those challenges? And I think hopefully what we've shown you today is a way that through collective action that you can change the system. We found that connecting with each other as a group, sharing our learning and using people's strengths to advantage can create that transformation that we want. And what we've seen is that that cycle of connecting, learning and transforming gets repeated between the projects that we make, and as we then go and talk about the work that we've done and the future work that we'd like to do. So I'd like to leave you with that. I think Tom's just going to talk a little bit about the Green Health Wales network just to finish off as well. Tom, you're on mute.
So Green Health Wales is Network for Sustainable Healthcare in Wales, and we've been pointing you to the website of Green Health Wales throughout today. So Green Health Wales was launched in June of this year, and we got engagement from all of the health boards. We launched it collaboratively with people across Wales, and at the moment what we're hoping to do is spread green groups across all of Wales, but we're also looking to link with lots of different groups. So these are some of the groups that have been part of the network of Green Health Wales, including the Welsh Environmental Anaesthetic Network, Cardiff University Sustainability and Healthcare Society, Swansea Action for Sustainable Healthcare, Greener Practice Wales, which is a network of GPs. So there's lots of work happening all across Wales, and it's important that we sort of all stay in touch with each other and support each other with the work that we're doing, and learn from what other people are doing and help spread those projects and ideas across Wales to keep the momentum going, because it can be, I think, as Gwen was saying, there are challenges to press bringing about change, but when we all work together, you know, it's much easier to bring about that transformational change. So I think after today, it would be really useful that we can all stay in touch with each other. What we will do is send out some feedback. So we'd just love to know what everybody thought of today, what could have been better. And we'd love to be able to stay in touch with everybody and have a future meeting just to catch up and see how everybody's getting on with all of the green groups. So that likely won't be until the new year, but if you can give us some feedback on when you would like that to be, and then we can get a meeting in, and then we can all you know, continue the conversation and, you know, continue connecting amongst yourselves if you made some connections today as well. So these are our contacts, so please do stay in touch with us and make best use of, you know, of our website, and reach out to us for logo, for any advice or anything else, any other questions that you have after today. So thank you everybody for joining. I hope that, you know, it's given you something to, you know, get started on and given you some ideas